I am Dr. Asunna, Senior Specialist from District Hospital, Dimapur.
So, ma'am, can you kindly highlight how many cases have been registered today?
Today, till now at 1 o'clock, we have 80 new registered, and all the cases of conjunctivitis are new. New cases of conjunctivitis has been registered. Now, we are getting elders also, parents are also infected, and children are also coming. So from few days, we are getting no specific age group now. Like children are also there, 10 to 17, 20 years, 5 years, 2 years, and we are getting elderly, 40 to 50 years also.
So, what was the highest number of cases registered till now on a specific date?
It was on 16th of August, we have registered 129.
129.
Yes, and the consequent on Friday and till today it's 80. Till 1 o'clock we have OPD again some other 2 hours more.
So, what is the current scenario of the flu in Dimapur as of now?
My assessment is only from District Hospital Dimapur, and it has said that today is also 80. The highest number been registered on 16, that is 129. And for the other part who doesn't come to the hospitals and who are getting treatment from the other private hospitals or maybe some other pharmacies and all, that I cannot assess, but this what I am giving the assessment of till today is all of District Hospital Dimapur.
So, it has been evident that parents come with their children for checkup. However, you mentioned that there are infected persons who does not come to the doctor to the hospital for checkup. And with the statement, so can you brief on that?
Yes. Like some families, like they have 3-4 children at home, but the one who is more severely infected, the parents, they bring that child to us and then they requested us to write the medicine for other children also. So sometimes they ask where we can use the medicine for elderly or for the children. So we try to write a mild dose of antibiotics, 0.3% of tobramycin we are writing, and for the elderly we are writing moxifloxacin. So when they ask and approach us that at home they have another 3-4 children or some elderly parents are also involved, so we try to help them by giving the prescription for the elderly and also for the children. So patients coming to us from one family, sometimes only 2 of them or 1 of them comes, but they get the prescription for the other rest who are ill at home.
So, you mean to say that the number of cases would actually be much higher than the number registered in the
Yes,
hospital?
yes. That is how, because when they approach us to write for another 3 children are sick at home, 2 children are also having the same problem. So when we think it over in that situation, the numbers which we are telling will be much more triple or double of that.
I believe that I've been informed that there are 2 types of conjunctivitis.
Yes.
Can you care to explain to the viewers regarding that?
We have a bacterial infection and viral infection. Dimapur, which I am getting in the district hospital, maximum is viral, but we are also getting bacterial infection also. So accordingly, we treat them. And we are asking for follow-up after 1 week, but very few turns up. So whether any complication has started or not also, it will have difficulty unless they come for the follow-up. But few patients, I have a photograph that some patients, they took the medicine from pharmacy and it happened to be a steroid. And the elderly patient, I have the name registered, everything I have recorded in my register. So he was an elderly from Newland and he has put that steroid medicine for 1 week and he developed keratitis, that is the cornea is also involved. So with keratoconjunctivitis, with the steroid eye drops, he came to me. So that is how the awareness should be given for the public also, that blindly they should not take the medicine from without checking up from the pharmacy, which is very important for all the public.
So it is advisable that any person suffering with the eye disease should visit an eye doctor in spite of going to the pharmacy to get the drops.
Yes, because they go to the pharmacy and they may take the medicine, like it happened to my patient, that he has started using steroid for viral conjunctivitis and he developed keratitis, and after getting complication, if he comes to me also, it will take time, and there is no guarantee also that you will be all right within 1-2 days. It may take for months, so that kind of complication may develop. So it has been given repeatedly this awareness that better to show to any of the ophthalmologists in Dimapur and try to get a treatment.
So is there a difference of symptoms for the bacterial and the viral?
Bacterial infection usually comes with a very thick discharge, and the swollen of eye is there, swelling of the eyelid is there in all viral also and in bacterial also. But when it is bacterial, the discharge is more, and only in the beginning we have done the swab. Now with the symptoms we are trying to prescribe accordingly the patient presentation, and with the clinical examination, with the slit lamp examination, we try to differentiate. Maybe a mixed infection must be there. It is not necessary that a patient get a viral infection will not have a bacterial infection. He may have a mixed infection also. So accordingly we see the patient and we are treating.
Ratio-wise, which group of people are possess the higher quantity of being infected, the children or the adults?
Maximum is school children. Yes, but since this last week, elderly like 40, 35, 50 years, 60 years are also coming. But in the beginning, it was the maximum school children. And when we asked from where you got the infection, then the children used to say, some of my friends in the school were infected, they were asked to send them home, and then the next day I also developed. So that was the reason they were telling us.
How is the disease spread amongst? Is it through eye contact or is it through physical touch?
It is direct contact, that is, a patient having infected eye, if we are using and touching the patient's hand, or like the pen, the books, and then the towels, handkerchief, all these things are there, and directly through the secretion, which may also be, even though we don't intentionally touch, but the secretions are there. When eye tearing secretions are there, that also can lead to infection directly also, sitting nearby. But looking at the infected eye from the far, it is not the cause of infection.
So what would be your advice for those who are infected? Using the doctor recommended medication is one thing. What would be the other thing, precautionary steps that he can take in order to stop the spread?
To control the spread, it has been advised frequently that frequent washing of hands, because infected person, he has irritation in the eye, he has discharge, so he has to touch with his hand, because for wiping or for cleaning. So frequent washing of hands using sanitizer, and also like avoid contact with the other person who are not infected. And I have already given this awareness also, that using of for the female, using of eyebrows, eyeshadows, mascaras and all, this also has a chemical, so when you have infection, it will infection will exacerbate with it, more pain will be there. And again, we have given that Like many people have a confusion that wearing dark glasses will prevent the infection. Dark glasses may be prescribed for some patients who are having photophobia. So to see the light when you have eye infection, you cannot. You have difficulty. So for that, going out or to protect the or to give the relief to the eye, photophobia means it's the light and color reflections. To prevent that one, we are asking to wear the dark glass, but dark glass does not prevent the spread.
So it is evident that many shopkeepers, especially in the market areas, they are infected ones, but then they are still operating their business on a daily basis. So what would be your advice to them?
Market area people, it's for me the only those people who are coming to the hospital. I'm concerned about that, and I know the conditions. But in the marketplaces, if the infected shopkeeper is still continuing to sell his products and all, then that is the authority to take care, and he can be at least not mixed with the public freely. He can go for the treatment and isolate for 1-2 days, at least till the infection is there. They should voluntarily isolate. Like pharmacies, in the pharmacy, the shopkeeper is infected and it is giving to the eye drops or any medicine to the patient who are not infected. This they may spread. So it is for the voluntary for them to isolate themselves and take the get treatment.